So now we're on to the videos for manual techniques, and the first one that we're going to do is percussion. So percussion is a technique where you make a cup with your hand and you percuss over the different lung fields. You need to make sure that you've got a floppy wrist when you're doing it, and you're sort of aiming for contact every 2 seconds, and what you're aiming for is a nice hollow sound, not a slap. So you need to make sure you've got that cup when you're using the technique. And what it is percussion is for that it generates short bursts of energy waves, and it causes secretion movement within the alveoli and along the mucociliary escalator, and this allows for sputum movement centrally. It is more suited to patients who are unable to cooperate with voluntary breathing techniques, such as small children, patients with neuromuscular pathologies, and ventilated patients where vibs and shakes, which are other manual techniques, are specifically contraindicated. So we're just going to go through the technique now with Lizzie. So like I said, you want to be aiming for this cupping shape with your hand, and what you're going to do is make sure you get in all the lung field. What I'm going to do is just one portion, the middle area of the lung. And what you're aiming for is a nice hollow sound. You normally use a towel over patients just for their own comfort. So what Lizzie, what I'm going to ask you to do is just to lift your arm above your head just to there. Obviously you want to watch the lateral border of the scapula also, because if you're percussing over there, then that is going to be painful. Also with female patients, you do want to watch where you're percussing, obviously because of breast tissue, etc. And that would be uncomfortable, and you also wouldn't be getting the desired effect within the lungs. I'm just going to cover the area with a towel, but first working out where I want to be. So I'm just going to percuss over here. Okay, is that okay, Lizzie? So I'd obviously have taken all my jewellery off beforehand, and then I'm just going to start with 30 seconds of percussion. And what you're aiming for is a nice hollow technique. In terms of how long you do it for, you apply the technique for 30 seconds. You don't want to be doing it for longer than 30 seconds because it can cause desaturation. This could be applied twice to each area of the lung for the whole treatment. In between, you can use the forced expiratory technique and also encourage the patient to cough if they have any sputum to clear. Now, there are side effects associated with this treatment, and such as it can cause bronchospasm in patients with particularly reactive airways. So having knowledge of how the patient reacts, whether they're taking bronchodilators already, they may want to have a bronchodilator before treatment. If the claps or the percussions are too forceful, then what you're going to cause is you're going to cause the patient to hold their breath. Now this is going to hamper the effect of the treatment, and you're not going to get the effect that you desire. So using too much force is a bad thing. Also, if you're using it for over 30 seconds, it can cause an increase in hypoxemia, and that can cause a decrease in saturations of oxygen. Complete contraindications to treatment would be a lot of osteoporosis, higher osteoporosis score, like a high black score. If the patient's got frank hemoptysis, again active TB, or whether they've got a metastatic carcinoma, either in the lungs or around the ribcage area. Pain and poor skin integrity is another contraindication.